Folks, thanks for coming on with us today. My name's John Duvos with Premier Marketing, and we'll be spending the next hour or so discussing the timely topic of being thankful for extra benefits. Putting it into our world, what we're going to do for the next hour or so is speak of some of the ancillary programs that exist that help us with our primary market here in the Medicare world. We have a guest speaker with us today, and they'll be discussing the portfolio of programs that they have to offer that make it easy for us to take care of our prospects and clients. Today's presentation is being recorded, and it, along with information that is alluded to throughout the course of the presentation, will be sent to all who have RSVP'd to today's presentation. A bit of background information about Premier Marketing, for those of you not familiar with us. We are a national marketing organization that was founded in 1968. We're part of the Integrity Marketing platform with offices across the country. We act as an insurance wholesaler offering insurance contracts for different programs through independent insurance agents such as yourself. Those contracts are available at the highest possible commission levels, and recruiting contracts are available to those who qualify. As I mentioned, we were founded in 1968, so that means this past year we celebrated a milestone in our history, our 50th anniversary. It's quite an accomplishment for what began as a family agency in rural Nebraska that's grown into one of the premier marketing organizations, no pun intended, in the Medicare space for both Medicare Advantage and Medicare Supplement products and ancillary programs like what we'll discuss today. We do so through a full insurance portfolio that includes coverages for people on Medicare, including Medicare Advantage and Medicare Supplement programs, and the standalone Part D prescription drug plans. We also offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, a portfolio of long and short-term care programs, disability income plans, and ancillary benefits, much as what we'll discuss today in the dental, vision, and hearing arena, and also programs for critical illness and cancer plans and hospital indemnity programs. Those Medicare Advantage partners that we work with are all the national carriers and many of the strong regional carriers that can make a difference for you in your market. That same philosophy carries over into the standalone PDP portfolio, where the national carriers are available to you through our organization. The Medicare Supplement portfolio is very broad and has a number of programs that are designed to help you be successful in that space as well. The ancillary products, like what we'll speak of today in the different categories, have all the name carriers in that space as well. And our special guest today speaks to us in regards to the SureBridge portfolio. We look forward to that discussion here very shortly. When we look at the Medicare market and the opportunity it presents, we see a burgeoning, growing opportunity. You don't come on a program like what we have today without a person like myself speaking to the 10,000 plus people a day, turning 65, one every 10 seconds. But when you look at the number of people who are on Medicare itself, we have to take into account that about a sixth of the number are under the age of 65 and access that benefit through Medicare disability. And there are a few people that once they reach 65 don't access Medicare immediately. They continue to work or draw their benefits from another source. So we have a very large market that's very diverse, and it has some challenges with its health and with its wallet. So it's important for us to have a portfolio of programs that help address those needs and help people budget for what is inevitable for all of us, some challenges with our bodies. When a person accesses Medicare, they have a number of options as to how to proceed in order to cover themselves for different health circumstances. The first one is the old decision to make a decision is a decision. Many folks don't do anything. They keep original Medicare and don't do anything else. They self-insure for everything that is not covered by traditional Medicare. There are some folks that will add drug coverage through a standalone Part D program or look to a traditional, standardized, modernized Medigap policy and Medicare supplement program in conjunction with that drug policy to cover cost. And then there are folks who will also go into Medicare Part C and assign their benefits to a private insurer and access their benefits in that fashion. So you have different choices that they can use, but none of those choices help a lot with certain ancillary needs, particularly the dental arena. When we look at dental coverage, a big percentage of the folks that are on Medicare don't have coverage at all, haven't been to a dentist in quite some time, and even though they say they plan to visit the dentist within the next year, less than half of them actually do. Cost is the major reason why they don't do so. So offering programs that help with those costs and help folks budget for those needs can be a real help to the people we serve, because obviously Medicare doesn't cover a lot of the dental expenses, very limited in the services they do cover. And remember, almost 2/3 of the people on Medicare have no dental coverage at all. For those folks who have chosen an option that does offer dental coverage, some of the Medicare Advantage programs do, they will often find that the coverage that comes with that program is inadequate for what they need. And that includes people who have access to that coverage either through a regular MA program or even a dual program where those benefits are not rich enough to cover the full expense of the dental procedures that they encounter as they go through life. It's important to note too that one of the things that's really powerful with dental coverage is many of the chronic diseases are diagnosed through a dental office. So a side benefit of having additional dental coverage and regular visits to a dentist helps a person with their overall health as well. So what we have today is a guest speaker from SureBridge to come on and speak with us about the portfolio of products that they offer to help in this regard, not only with dental coverage, but other ancillary needs as well. And we welcome Mr. Mike Zundell. He's the Senior Sales Director with SureBridge, and he will walk us through a number of different programs and logic for these programs as well in order to help us properly present the programs to address the needs of the people that we visit with. So, Mike?
Thank you so much, John, and thank you guys all for joining us. Really appreciate you hopping on. I know this is a kind of an interesting week in our industry between kind of being, right in the middle, actually getting more towards the end of AEP, and then, of course, having the holiday break here coming as well with Thanksgiving. I've always thought there's so many challenges with our industry, one of which is definitely that this big holiday week of Thanksgiving falls right in the middle of AEP. So the fact that amongst everything else you guys got going on, you jumped on here with John and I today, that really means a lot to me. So again, thank you guys for doing that. I'm very thankful to have you on. And I'm going to talk to you again today, really just what John talked about some ancillary products that I think if you talk to your clients about today, and hopefully during this AEP, and hey, if not during this AEP, the first of the year is a great time to talk about these plans too. Of course, we can sell these 12 months out of the year. But I think your client's going to be very thankful and very grateful that you had this discussion with them and that you went the extra step and really offered them a more holistic and customized healthcare solution than what many of your competitors are doing. So I'm going to really talk about that a lot today. But first, I want to give you guys a little background on SureBridge, because I know some of you may not be too familiar with us. Of course, now that Premier is a partner with us, we are getting a lot more exposure out, particularly in the senior realm. And I got to tell you guys, I think we've been one of the best kept secrets really in the senior space, because we for years have been a large, fast growing ancillary health carrier where we've done a lot of business in the under age 65 space. Kind of think of this same concept of filling in the gaps in a health insurance plan, just like we are with the MAs and the med sups. But again, traditionally, we were doing this with under age 65 health insurance, be it ACA plans or short-term medical plans. Last year, we did over 134 million of submitted premium. And now with this new Premier partnership, we are tracking to just absolutely blow that number out of the water here in 2019. There's really never been a better time for you guys to start talking about SureBridge with your clients. And the reason that I say that is as of this spring, we were actually acquired by United Healthcare. And we are now a part of the United Health Group family of companies. So if you ever talk to a client that says, you know, I've never heard of SureBridge or I've never heard of Chesapeake Life, and by the way, we're going to use those terms kind of interchangeably. Chesapeake Life is who we really are. SureBridge is the brand under which we market these products. But again, now you can go to these clients who say, I don't know who Chesapeake Life is. I don't know who SureBridge is. And you can let them rest assured that we are now a part of really the preeminent health insurance company in the United States. And they believed enough in what we were doing that they actually acquired us and brought us into the fold. And what was great about that too, overnight, we went from a B++ carrier to an A- or A excellent rated company by the AM Best. So again, we are just so excited, and I'll try not to ham too much up on the thankful puns today, but I will tell you, everyone at SureBridge was really thankful that we are now part of that United Health Group family of companies. You know, I've been out for about the last 9 months really just talking to agents in the senior space, trying to pick their brains, you know, really talking both to the many agents out there that really aren't cross-selling ancillary plans, and then also talking to the smaller subset of agents that really religiously do this and are bringing up these products with every single client that they talk to. And I've really been fascinated to learn, you know, what is the difference? Why is it that some agents continually cross-sell plans like DVH to their Med Sup clients and plans like hospital indemnity to their Medicare Advantage clients, again, while so many others are not. And what I'm starting to see is I think we've got some folks in our industry that still are not sold on the concept. You know, let's just forget about SureBridge for a minute and let's talk why sell ancillary products to begin with. You know, when in talking to folks, one of the things I've realized is there is a little fear out there that, you know, maybe you're marketing a product that you're not as familiar with. You know, you're an expert in the Medicare field and you know the MA plans inside and out. You know how the Med Sups function. But now when you get into these other sort of products, you might get out of your comfort zone a little bit. And I found there is this particular fear that, you know, something might go wrong with this sale. I'm bringing a new company into the fold here. And if my client gets upset, there's the potential that I could actually lose my Medicare client. And with that being my bread and butter, it just doesn't seem worth it to me to risk all of that for an add-on sale. And I've got to tell you guys, if anyone on the call feels that way right now, what I have found, both anecdotally and in some statistical data, and I'm going to share some stats with you here in a minute, is that could not be farther from the truth. I have seen time and time again that agents that cross-sell these ancillary products and, again, create a package that isn't so easy to be replicated or replaced, they, on average, see higher client retention than agents that are just out there selling Medicare and MA plans and Med Sups. Okay, the agents that I've talked to firsthand have told me, you know, when I started doing this, it was really just kind of a, you know, an add-on. Do you want fries with that? But as I've progressed with this, now it is such an important part of my business, and it's actually a way that I've been able to take business away from my competition because I'm going in there and I'm showing them that I'm really focused more on covering all their needs and not just selling their Medicare. Well, here's a very interesting chart that I found, and basically what it shows is the number of insurance products sold to one client by one broker, and then the odds of that product still being enforced 5 years from today. So you look at just a typical sale, one product to one consumer, 5 years from today, we've got about a 20% chance that plan's going to still be on the books. Now we double that and we go to two products. Now both those plans, 65% chance 5 years from now, they're still going to be up and running. And look when we get to three, the old trifecta. Now, in most cases, you've got a client for life. 85% of the time, those products are still in force 5 years from today. So again, if anyone on this call has that reluctance or that hesitation, I urge you to give me a call directly, and I would love to talk with you some more about this. And I think I can convince you that selling ancillary products is the best thing that you can ever do for your practice. So that to me is just the first reason why we'd want to look at ancillary plans. Okay, the second one I just mentioned, most agents, most of your guys' competition right now is not doing this, okay? I would say probably about 70 to 80% of advisors are not cross-selling these plans, specifically in the senior market. So just alone by doing this and adding this to your tool belt, you now are going to start to differentiate yourself from your competitors. And again, like so many countless agents I've talked to already, you're going to find yourself able to really start stealing away business because you're offering something that they're just not offering. You know, another thing I've heard a lot of agents say is, you know, it's just not worth it for me. The premiums on these plans, they're relatively small premiums. The commissions on these plans, you know, they're not as high on some other products that I have potential to market. And it just doesn't seem like it's going to really be a revenue generator for me. Well, first of all, I just talked to you guys about client retention. And to me, that boost in client retention is going to be enough to add to your bottom line. But if you look at it this way, and again, Premier is offering such a great comp schedule on this plan. It's part of the benefits of working with Premier. They've got you guys at a much higher comp than really most folks out there. But with the comp they've got you at, just our street, you know, the street level comp, as Premier calls it, street. If you sell one DVH app per week, okay, and the average DVH premium is about $500, you sell one per week, you're going to generate an extra $13,500 of commission per year. Okay, now I know that's not enough money to retire on, but how many of us on this call wouldn't like to make an extra $13,000 this year? So don't minimize really the financial impact that you can have of selling these plans. And I'll tell you that this is a low end. This is a once per week. We've got an agent with Premier right now that has sold over $60,000 of DVH premium. She literally talks to every single one of her Medicare clients about this plan, and she is going to make substantially more than that $13,500 that you're going to make just by selling one of these every week. Okay, and so there were really three kind of what's in it for me reasons that I think every agent needs to sell these plans. But I want to cap it off with really the most important reason, and really the one reason you should ever sell any insurance product to any of your clients, and that's because they need them. These plans, the three plans I'm going to talk about today, I have seen time and time again them make a difference in people's lives. Okay, whether we're talking about paying off your deductibles or your max amount of pockets, or simply having the ability now to go see your dentist and your optometrist and your audiologist every year because it's a benefit that's going to be paid for, or if it's the fact that you get the financial security and the additional money that you're going to be able to use to access really the best health care possible. If you are a senior, these are plans that you really need. And it's really unfortunate right now that so many clients in this market really don't even know much about these plans or how they work or how they function. And you as the agent, you know, it really is your job to do this. And unfortunately, if you don't, nobody else is going to. So again, I'm going to jump now into really the three SureBridge ancillaries that we're seeing a lot of sales in. But I don't want to minimize this portion of it. You know, I hope to God that you guys sell my product, and I'm pretty confident you're going to because we've made some really great plans. But I urge you, even if you're not selling SureBridge, you really want to think about adding these products to the mix because they are going to make a difference in your clients' lives. And the other thing about it is it's really much, much easier than people think. It is as simple as asking your clients a few questions. And, you know, I like to ask agents this, and it's interesting. Sometimes you'll see, you'll have an idea of where these ancillary sales fit, you know, into their space by how they answer this. If I were to ask you guys right now on the call today, when was the last time that your clients saw the dentist? And how long has it been since they've completed an eye exam? And really, when was the last time they had their hearing checked? You know, I would guess that some of you on this call would say, you know, Mike, I can't answer any of those three questions. I really don't have the slightest clue when my client saw any of those three medical professionals. And I think if you fall into that boat, that's a problem that we want to address. And hopefully after today, going forward, if someone asks you that question, that's something you're going to know the answer to. Okay, so when we look at the market for DVH insurance, it is absolutely huge right now. We have over 37 million traditional Medicare fee-for-service enrollees, and only 21% of those folks have private dental insurance. Now, in addition to that, we had over 8 million Medicare Advantage enrollees whose MA plans had no sort of embedded dental coverage. And even for those that did, many Medicare Advantage plans that have some sort of a dental benefit embedded in the plan, that benefit is going to be really pretty sparse. It's going to have some good coverage for preventative. It's going to help them, go get their exam and their x-rays. But if they need any sort of even basic or definitely major dental work, there's not going to be much coverage there. So this plan does still make sense to cross-sell even to your MA clients. And then I mentioned at the start, we've traditionally been an under age 65 company. And when we developed this product and all the products we've developed, we've made them available in the under age 65 space as well. So if you are doing some business outside of the senior space, this plan is also going to be a great fit for folks that don't have any dental coverage. And right now, that's about 1 in 4 Americans. So again, the market for a product like this is just absolutely astronomical. So you guys might be thinking, okay, Mike, so a lot of folks don't have dental insurance. Is it really that big of a deal? And I would argue, you guys, it is an absolutely huge deal, and more statistics are coming, more and more studies are backing that up. Okay, so first and foremost, dental coverage and going and getting your exam every year is the number one way of catching oral cancer. Okay, this more often than not is how folks are being diagnosed. They go in, their dentist sees something as part of the evaluation, they send them to the specialist, and sure enough, they're diagnosed with oral cancer. It is very important. This alone right here, for me, is reason enough we need to drive all of our seniors to go get their checkup at a minimum 1 time a year. Because if we catch that oral cancer early, we can reduce the chance of it spreading by up to 90%. And when you catch it early, it is a very curable and treatable disease. So again, if for nothing else, just for this oral cancer screening, we need to make sure folks are going. Now, you guys are probably associate certain things with having good dental and having good oral health and going every year. Things like preventing gum disease, like gingivitis, preventing cavities, tooth loss, and bad breath. But here's where it gets really interesting. We have found more and more studies now that are linking oral health to overall health. And individuals that don't have dental benefits are 29% more likely to have diabetes. They're 50% more likely to have osteoporosis, and they are a whopping 67% more likely to have heart disease. So more than ever, we are seeing the strong, unmistakable correlation with having dental benefits and going to the dentist each year and having much lower incidences of these other chronic diseases, things that you don't really even think about having any sort of an interaction with oral health. Okay, hearing. You guys probably don't think a hearing loss is a big issue, but it's actually the 3rd most common health problem in the United States today. It too is linked to other things like cognitive decline, brain tissue loss, depression, and even dementia. And there are almost 29 million adults in the United States today that could benefit from the use of hearing aids. I'm guessing probably all you guys on this call probably know of 1 or 2 folks firsthand that could definitely use a couple of those hearing aids. And then this absolutely fascinated me, vision exams, okay? The vision exams now are often the first to detect a number of different chronic diseases. 20% of the time now, this is how people are finding out that they're diabetic. 30% of the time, it's where they're being diagnosed with hypertension, and 65% of the time, so the majority of the time now when people are being diagnosed with high cholesterol, it's as a direct result of them going in and having their vision exam. So again, things you would never associate with good eye health, we are actually finding now in the exams because the optometrist can actually see the markers for these things when looking at your eye. My boss has a good friend that's an optometrist. He says he refers about 15 to 20% of his clients on to see some sort of a specialist just as a result of these sorts of things that they're seeing in that vision exam. So when you look at these three in totality, I think the picture becomes very clear that if we want our seniors to really live the healthiest lives they can live, then part of their annual routine needs to be going to see the dentist, to see the optometrist, and to see the audiologist. And that's where Prime DVH comes in as a really unique solution to this issue. Okay? It is, to my knowledge, the only plan on the market that is going to pay for preventative dental at 100% from day one and with no deductible. Okay? So when you think of the preventative dental, think of the x-rays, think of the exam, and think of the tooth cleanings. It also pays for vision and hearing exams at 100% from day one with no deductible as well. So again, I've been beating that drum really loudly that we got to get our seniors to go see those 3 doctors every year. We got to make sure that they get those exams done. Well, now with Prime DVH, we have a product that they can buy today, and they can see all 3 of those specialists tomorrow with absolutely zero out-of-pocket cost. And you know, you guys just do the math. Look up what the cost of just 2 teeth cleanings per year is in your area, and I would be willing to bet most cases the annual premium for Prime DVH is going to come in right around or even under that amount, that if they were just a self-insured and just get those 2 cleanings. Keep in mind, that's not even talking about all the other benefits on this plan. Some additional features that really stick out: there's no waiting period for basic dental procedures. I'm going to go through in a second here, the preventative versus the basic and the major. And then just a 9-month wait for the major dental procedures. Most of these plans, you see a 6-month wait for basic and a 12 for major, but we were able to cut those down and, again, covered basic immediately and just 9 for the major. The premiums on this plan are really the best in the market. You guys are going to see there's probably some other folks that'll be, pretty close with us. Some others that are going to be substantially more than us. But when you really pull these apart and get as close to apples as you can get, I think bang for your bucks from a premium standpoint, this plan is really a market leader. And the commissions, again, I mentioned this at the beginning, but I just hope everyone appreciates how special it is to have a partner like Premier that really is just going way above kind of the industry norms and the commissions they're paying out. So definitely talk to your Premier marketer about the comp on this plan and all the plans that we offer at SureBridge. And then this one is huge for us. We created this product with what we call a passive network. Okay, we wanted to give the client the best of both worlds, and we didn't want to restrict them to only being able to use in-network providers. So first of all, the network for the dental is the Carrington Maximum Care Network, one of the largest networks in the country. The network for the hearing is the True Hearing Network. They've got over, I think, 7,800 nationwide providers. And then there's actually no network at all for the vision. We're always just going to treat that vision as a reimbursement benefit. They're going to go to any optometrist in the country. But for the dental and the hearing benefits, again, we've got this idea of a passive network. And what I mean by a passive network is your client can go to one of those in-network dentists and audiologists and get access to some additional discounted pricing for these services. But they can also, say they have a dentist that they love that isn't in network. They can also go to that out-of-network dentist and in most cases not see a reduction in the benefit percentage that we are paying out. Okay, the big difference is if they go in network, we're going to base our payout off the actual charge that provider's charging. If they go out of network, we're going to cap our benefit on the 75th percentile of the usual and customary charge for that procedure in that area. Now, I know that is quite the mouthful, but think of it this way. Unless that dentist or that audiologist is charging more than 75% of their local competition, this plan is going to pay out at that exact same percentage that it would if they went to an in-network provider. Okay, I know that passive network can be kind of a lot to grasp. So when you're talking to your Premier marketer, we've got a great piece that they can send you that actually walks through a real life example. Hey, here's a procedure. Here's what it looks like if they go in network. Here's if they go out of network, but that dentist is charging within the 75th percentile. Here's what happens if they go out of network and that dentist is charging over that 75th percentile. And in that case, there's just a tiny overage that the client's going to be responsible for. But again, we've really seen a lot of success with this because certain clients, they don't want to buy a dental plan if their current dentist is not in network. And now here's a way they can still buy the plan and get excellent coverage, even without them being in network. So I told you guys there's going to be a little more detail on the breakdown of the 3 different types of benefits. This is by no means an all-inclusive list, but we want to give you an idea of some of the, the most popular claims that we see. So again, when you're thinking of the dental, or when you're thinking of the preventative, think of the cleanings, the x-rays, and the exams. When we get to those basic services, think of like basic restorative services and the adjunctive care, the diagnostic films, and fillings. Fillings is obviously a really big one under that basic category. And then the type 3, those are the big ticket items: bridges, crowns, extractions, root canals, dentures, all those bigger ticket items. Those are going to fall under type 3. And again, it's important to know we have a $100 deductible on this plan, but we are waiving that deductible for the preventative services as well as the hearing and vision exam. And all 3 of those are going to be covered at 100%. One thing in the development of this product, we found a lot of agents were not happy about with some competing DVH plans is the $100 deductible was applying to the preventative and to the vision and hearing exams, and then they were only covering 60% of the actual charge after that deductible was applied. And I've had agents say, I stopped selling these kind of products because I had so many upset clients. They'd buy the product, they'd go to get their teeth cleaned, and then they'd get the substantial copay. And from the client's perspective, they're like, why did I buy this plan if I still have to pay a copay just for something as simple as a cleaning? And again, that's where this plan really stands out. They're going to be able to go and have a $0 bill at the end of all 3 of those appointments. Okay, now the basic services and the major, that $100 deductible does apply to those. And to be clear, it's $100 deductible across all these benefits. So there's not, a $100 deductible on the hearing and one on the vision and one on the dental. It's just that one between the whole entire policy. And the major services, again, we're going to cover those after 9 months. And for the basic and major, we're looking at 60%, 70%, and then 80% years 3 and on the plan. The hearing benefits, we're talking about the hearing examination, the purchase of the hearing aids, any necessary repairs to those hearing aids. And then again, if some of the biggest benefits of using our hearing product is that they can get access to some really great network discounts if they go through the True Hearing Network. And you'll see on our network search tool, and again, your Premier Marketer, they can send you the network search tool for both the dental and the hearing benefit. But you'll see right there on that search tool, they've got some actual examples of retail price for hearing aids and then the True Hearing price. And you're going to see, in some cases, you're going to save more than $1,000 per hearing aid. So being a part of that network is really, really big. For the vision, we're talking about comprehensive eye exam, the contact lenses, the frames, the corrective spectacle lenses, and then the corrective spectacle lens fittings. And with both of, and then the follow-up visits. And then these benefits do have some internal caps. So we've talked about the exams. You see the $75 max there on the hearing. If you go to a True Hearing provider, that actually is going to be the cost, so it'll be covered right at 100%. And then for the hardware, think of those like the major dental service. So there's going to be a 9-month wait. Then after that 9-month wait, they're going to have access to glasses, contacts, and hearing aids, and they'll be covered at 60, 70, and then 80% the first 3 years. Maximum combined vision benefit is going to be $200 per year. The maximum combined hearing benefit is $500 every 2 years. Now, there is no internal maximum on the dental. They can use their entire benefit amount on the dental services. So here's the pricing on the plan. I told you guys, very, very competitive pricing. We've actually got 3 different benefit options that you're going to be able to choose from. So you see we've got the $1,000 max spend, we got the $1,500, and we've got the $2,000. And then we've got 5 different age bands within that. Okay, now this product is issue age premium. So whatever age they are when they buy this plan, they're going to lock themselves into that age band. They're not going to have to worry about this premium going up when they jump to that next one. So you might notice there it was kind of by design. We've got that one age band that ends at age 65. So if you've got a client that's 64 or they're 65, it's a great way to create that sense of urgency. Hey, let's make sure we don't wait till you're 66, because your premiums could be as much as $14 a month more if we wait and don't do it now. I told you guys it's really funny because we keep talking to the top DVH sellers, and we keep trying to figure out what's the secret sauce. How are you guys so successful? How are you selling so much of this? And every single one of them, they always kind of look at us with this kind of funny look on their face, like, it's funny because there really isn't any magic bullet to this. It is literally as simple as just asking some questions. If you guys remember what I started with, when's the last time you had your teeth cleaned? How long has it been since you've seen the optometrist? I saw the average senior has not been to the eye doctor in over 5 years. And when's the last time you completed your hearing examination? Or did you know your basic Medicare does not cover you for your basic dental services? It has nothing to help pay for your vision exams, your glasses, and your contacts, and there is nothing there to help for your hearing exam or your hearing aid. But now we have got this absolutely great solution for you. So again, if anybody on this call has not sold DVH, particularly to your med sup clients, I got to tell you, you're going to find it is probably the most natural cross-sell product that exists in our industry today. I've had a lot of agents that will come up to me and say, I should go ahead and get contracted for SureBridge because every once in a while I'll have a client ask me about dental insurance. And over time I've started to challenge them a little more. And I say, there's really only ever one reason that a client is ever going to ask you about dental insurance. And that reason is that you haven't already talked to them about it. So if you wait for the, 1 out of 10 clients that has the forethought to think about the fact they're losing their dental, you might sell this here and there, and you might actually struggle to get through it. If you make it a part of your process and you ask these 3 questions, or you just highlight in the Medicare book, in the guide, hey, circle that part where it says dental, hearing, and vision services are not covered. That's really all you got to do to start the conversation. I think you guys are going to find a very, very high percentage, particularly of your med sup clients, are going to want to sign up for a product like DVH. So we just launched this thing back in April, and we've been really excited. We have gotten it approved now in 37 states and plus DC. And then in January, we're going to add 3 more states. We're going to be launching in North Carolina, Virginia, and Montana. Now, I'm not sure on the exact launch date yet, but it should be early to mid-January. We're going to have it in those 3 states as well. And then that leaves just a few more holdout states that hopefully we'll be getting the plan approved there sometime in 2020. All right, I'm going to move on now to what I think is probably the most undersold product in the senior space, and that is critical illness. Critical illness is a product that is really kind of coming into its own in our country. It's been so popular in some overseas markets, and we're finally getting to the point now where more and more consumers actually identify that term critical illness insurance and know what it means. But we're still haven't seen a lot of growth, really frankly, in the senior market, and I think there is a lot of potential there. And before I get again into the SureBridge product, I want to tell you guys, I've over the years got to talk to lots of agents that have been passionate about this product. And what I've seen is over time, as they've sold more and more of it, their sales have really accelerated. And a big reason why that happens is because once you sell this plan for a few years, your clients are going to start to claim on it. They're going to, unfortunately, be diagnosed with cancer. They're going to have a heart attack. They're going to have a stroke. And when they receive that lump sum check, it's almost like that's when they fully buy into what you sold them. And at that point, it is one of the most rewarding insurance products you can sell a client because literally you may be able to save them from bankruptcy, or you may be able to save them from some really crippling financial debt because you talked to them about a product they didn't even know existed before you brought it up. So again, I said the dental is like maybe the easiest cross-sell. I'd say this one takes a little more work, but the payout at the end and what you're doing for your client is really, in my mind, unparalleled. And I've found over the years, every agent that sells a lot of this, they somehow have the 4-question critical illness discussion. And they kind of tailor this to their own methodology. But one way or another, they're kind of getting these 4 points across and doing it through these questions. So the first question, who do you know? Who do you know that's had cancer or had a heart attack or had a stroke? And I think every single person you talk to, they're going to know probably not one, but multiple people that have been through this. And the first one that's going to pop into their head is going to be that person that's closest to them in their lives. You asked me that, my first thought goes to my parents. Both of my parents are cancer survivors. So I instantly think about both of them when someone asks me that question. The next one, was it expected? Okay, I think we know the answer to this, right? The answer is going to be no, but it's an important question to ask the client because it's kind of reminding them, oh yeah, my brother Tom, one day he was fine, next day he goes to the doctor and his whole world is upended. Did it create emotional or financial stress? That term emotional is very important here because you will run into those folks sometimes that were able to fight off cancer without going into bad debt. Maybe they caught it early, they had good insurance. My dad is a great example of this. Had prostate cancer, they found it early, they removed his prostate. That was about 8 years ago, and he's doing great now. But if you include that word emotional, you're still always driving to that answer that you're expecting. And you're always going to get a yes to this answer. Because when you're diagnosed with cancer, the first thought is not the money. The first thought is, am I going to survive? The second thought is, how miserable is the treatment going to be? And then usually the money comes into play. So again, who do you know? Was it expected? Did it create emotional or financial stress? And then here's where you really drive it home. Would a lump sum check have helped ease that burden? That day your brother Tom was diagnosed. If he came home and there was a check for $10,000 or $20,000 or $50,000 waiting for him on the kitchen table, how would that have changed the next 6 months of his life? What sort of options would he have had during the treatment and the recovery that otherwise just weren't available to him? And again, once you kind of walk your client through these 4 questions, I think more often than not, you're going to find many folks are going to be very interested in learning more about this product and ultimately in purchasing it and getting that own sense of independence and freedom to choose how their health care is managed should the unthinkable happen. All right, so that was my overall critical illness spiel. Now I want to talk to you guys a little bit about the SureBridge plan. So we've designed this product for maximum customization. We've started it with a plan called CancerWise Plus, and that is a benefit that just pays for cancer, both invasive and non-invasive. And then on top of CancerWise Plus, you can add the heart and stroke rider, and that's going to cover the client for heart and stroke. So now you've got them two together. Now it's a cancer heart stroke plan. Then you can additionally add the critical conditions rider, and I'm going to kind of go through what all these are, what they cover. But that covers all the other things that you see on these CI plans. So if we sell the CancerWise Plus with those 2 riders, we call it the CIWise suite, and then it really does look like a traditional critical illness plan. Maybe your clients already had cancer, so they can't get the cancer benefit. Well, now what we can do is we can just sell them the HeartWise plan, and then we can add on the critical conditions rider. Or vice versa, we could sell them just the cancer benefit without the heart stroke if they've already had a heart attack or stroke. So just think of these kind of 3 buckets as the different ways you can design the plan based on what their health history looks like and what is most important to them. And we've got a couple recurrence riders I'm going to talk about as well. So this is a product, again, that you can sell both in under age 65 and in the senior space. So if they're 64 or under, we're going to go up to $100,000. If they are a senior, 65 and or 64 and up, we're going to basically cap that benefit at $50,000. Product's guaranteed renewable for life, so they're going to keep this as long as they live, as long as they keep paying the premiums. And we don't have an age-based benefit reduction. Some CI plans, if the client gets to 65 or 70 and then they have a claim, they only pay out half the benefit. This is a level benefit for life. So you buy that $50,000 plan when you're 64, you make it to 100, and now you're diagnosed with something. And if you make it to 100, probably a pretty good chance you're gonna be diagnosed with one of them. You're gonna still receive that full $50,000 check. Premium factors, it is issue age and sex distinct. You're gonna smoke, so we're not charging a surcharge for the smokers. You're gonna find the males, you pay a little bit more than the females just because we have a higher incidence of these sort of conditions. Pre-X at 24/12, there is a 30-day waiting period, so if they're diagnosed in the first 30 days, the benefit is not paid. There is a one-time application fee of $20 on this plan. So all of our products, other than Prime DVH, we've got this $20 app fee. Prime was the first product we did without an app fee. But I want to be clear to you guys, when you submit your business through our online portal, and all the business you submit is going to be through that online portal, everything's going to come through on one combined application. So no matter how many products you're selling the client, how many family members you're enrolling, you're only going to have ever one $20 app fee. And if you're just doing DVH, again, you're not going to have an app fee whatsoever. We do have guaranteed issue amounts of 5 and 10,000 for the under age 65 space. For the seniors, though, we're going to always be simplified issue, and we are a true simplified issue company. So, earlier we were talking about DVH. That one's guaranteed issue. But this plan and the next plan I'm going to talk to you guys about, they are true except reject, okay? We don't do MIBs or phone interviews or personal history checks, MVRs, anything like that. We are literally just going to use our very liberal height weight chart, which can be found in our underwriting guide, and the health questions that we have for a particular product, which is also in the underwriting guide. So the nice thing here is it's instant decision. If you guys have a client and you're enrolling them in these plans, if they fit in that height weight chart and they can answer no to all the health questions, they are instantly approved. When you hit submit, you're going to see right there on screen, congratulations, you're approved. Don't ever have to worry about any extraneous underwriting on these products. Okay, so we're going to talk about the 3 benefits here. First, the heart benefit. So it's going to pay 100% for heart attack, stroke. It's going to pay 25% of the benefit for bypass surgery, 10% for an angioplasty. The cancer benefit, it's going to pay 100% for invasive cancer, 25% for non-invasive or cancer in situ. It's going to pay 25% for a benign brain cancer. And then we did add a $250 skin cancer benefit. So if your client goes to the dermatologist, they say, oh, it's just a basal cell, it's a mole. They remove it right there. Well, your client still has the opportunity to get a $250 benefit. And then that critical conditions rider, I told you, that's kind of the everything else that you cover on these CI plans. And some of these are really big for the senior market. So we've got ALS, coma, major organ transplant, end-stage kidney failure. But the 2 I think are really big for seniors: Alzheimer's benefit, and that pays out 100%, and the loss of independent living. If your client cannot perform 2 of the 6 acts of daily living, they're going to receive 25% of that lump sum benefit. So couldn't really market that as like a home health care, but a great way to kind of kickstart a client that may be about to have some substantial, home health care bills start to stack up. We have the recurrence riders I mentioned for the cancer benefit and the heart stroke. So basically, if they are diagnosed a second time with cancer, or if they have a second heart attack or stroke, we are going to pay 50% of that lump sum benefit again, as long as they have been diagnosed at least 365 days apart. So I don't know if we have any chicken littles on the call, but my wife, for example, she's always thinking of the worst case scenarios. So for those of you that may have a similar inclination, we were thinking of, in the absolute worst case scenario, how could one of these plans pay out? So this guy, Joe, he's probably pretty much the most unlucky guy on the planet. But just to illustrate how much a $50,000 plan could pay out, Joe here was diagnosed with leukemia. So we gave him the $50,000. Then a while later, he had a heart attack. So we gave him a second $50,000 benefit. Then the poor guy needed a major organ transplant. So he got his third $50,000 benefit. He was so lucky. Now he got a second cancer diagnosis, this time lung cancer. So he paid out that 50% benefit. And then to cap it all off, the guy had a second heart attack. So one more $25,000 benefit. So hopefully we'll never have a poor fellow have to go through something like this. But we just kind of wanted to illustrate. And the absolute most extreme example here, one $50,000 plan could potentially pay out up to $200,000. Then here's a case study for the senior market. We looked at Victor and Sandy. They just turned 65. They're enrolling in a Medicare Advantage plan. And they're worried about those out-of-pocket costs, those out-of-pocket maximums on the MA. And specifically, if they were to have a cancer, heart attack, stroke, or be diagnosed with Alzheimer's. So what we did is we created a $20,000 CI plan. And you can see what those individual bucket amounts are going to cost, both Victor and Sandy. And as I mentioned, those guys were going to pay a decent amount more than our female counterparts, just because a little more likely to get these things. But we were still able to keep that premium under $75 a month, even for Victor. And in this example, we use this as a Medicare Advantage, how to fill in the out-of-pocket. I'll tell you guys, for your I would say like semi-affluent med sub clients, I think there's a great sale to be made there too. But again, instead of so much talking about the out-of-pocket exposure there, what I think you would really want to do is talk about making sure they have access to the best health care possible, and that if they have the funds, that if they want to go to some, physician that may not be covered, or if they, more likely if they have some experimental treatments that they want to try, or maybe they want to go to the Mayo Clinic, but the Mayo Clinic is a 2-hour drive away, and they need to stay at the hotel by the Mayo Clinic every night. Those can be $200-$300 a night easily. So I think when talking about this plan for your Med Sup clients, it's really, hey, we want to make sure if something happens, if you're diagnosed with cancer, heart attack, or stroke, like you told me your brother was, that you're going to have the funds necessary to really do whatever you need to do to access the very best health care that you can to fight this thing off and get back on your feet. All right, so I'm going to wrap us up now with the last product that, to me, we just showed both of these plans as a potential for your Medicare Advantage clients, but there is one above all others that I would start with when working with an MA client, and that is our hospital indemnity plan. We call it HospitalWise, okay? And this product, again, issue age 0 to 90. Like I mentioned with the CI, accept, reject, instant decision underwriting. This one's going to be good for life as well, guaranteed renewable for life. Issue age, unisex, unismoke, again, not charging a surcharge for the tobacco users. And this is one of the few plans we've got where we actually do some family rates. So if you ever have a husband and wife, or a parent and a children, or an entire family, you do get access to some discounted pricing. We just did a 6.6 pre-existing on this one, and basically, we knew that some of our competitors had a guaranteed issue offering. We wanted to keep the premiums down, so we didn't do a GI, but instead we said, you know what? Instead of that typical pre-X clause, we're just doing a 6.6. So basically, for the first 6 months this product is in force, we're going to make sure if they have a claim, it wasn't a pre-existing condition from the previous 6 months. No waiting period on this one, and we got that same $20 app fee we talked about with the other products as well. Now, it all starts with a base confinement benefit, and basically that benefit's going to pay out every day your client is confined to a hospital room. And you guys are going to pick both the benefit amount and the benefit period. So in terms of the benefit amount, you can go as little as $50 or up to $1,000 per day, and anywhere in between that in units of 50. And then for the benefit periods, we have a 3, 6, 21, 18, and even a 365. Now, we don't ever want to be on the hook for a $365,000 hospital claim. So you'll see there are some limits on how high of a daily benefit you can offer if you're doing some of those longer benefit periods. But if you get down to that 10-day, then you can go all the way to the $1,000 a day. There's an observation benefit built into this plan. That's really important. If your client goes to the hospital and they're never truly admitted, but they're held there for observation, we're going to be able to pay out one time that daily benefit amount as long as they're held for at least 12 hours. And then there's a mental nervous benefit built into the plan as well. So if they have a mental nervous confinement, we're going to pay them $250 a day for up to 7 days per year for a mental nervous confinement. So again, this is where we're starting, the base actual confinement policy. But when we talk about using this plan with an MA plan, where it really, really gets to be a perfect fit is when you start to utilize some of the riders that we've created for the product. So first is a lump sum confinement rider. That's going to pay between $250 and $3,000 once per year if they are hospitalized. So think of this as a way to kickstart that daily benefit. You might have them on a $100 a day benefit, then you add on $1,000 on this lump sum rider. That's the way the very first day of hospitalization, they get that lump sum check of $1,000. We've got the outpatient surgery, so anywhere between $250 and $2,000 up to twice per year. The client needs an outpatient surgical procedure. This next one for me is huge for the MA clients. A skilled nursing facility rider. We pay between $100 and $500 per day if the client is confined to a skilled nursing facility. And look at the benefit periods we offer for this: days 1 through 20, days 1 through 100, or for your MA clients, days 21 through 100. Now, most MA plans I've seen, they're going to fully cover skilled nursing days 1 through 20, and then typically days 21 to 50 or days 21 through 100, there's going to be a copay there that client is going to have to be able to pay for. ER, we're going to pay up to 4 times a year, $100 to $500 for a trip to the emergency room. One big differentiator on this product compared to some of our competitors, the benefit is not contingent upon hospitalization. Okay, so if your client goes to the ER, they're immediately discharged from the ER, this benefit is still going to pay out. And it's important because that's one of the most heavily utilized benefits on these hospital plans. The ambulance rider, between $1 and $500 up to 4 times a year for an ambulance ride. And then an outpatient diagnostic between $1 and $500 up to twice per year, thing of CT, MRI, PET, CTA, EEG, or EKG. All right, so that's always a lot of fun going through product features, right? Let's talk about how this actually works with an MA client by showing you guys a very simple case study. Okay, so Jane is 65 years old, just enrolled in one of the very popular low-cost MA plans in her area. And, you know, she was excited because she saved a lot of money over going the route of the traditional Medicare and the Med Sup. So with all that money that she saved, though, you know, her agents helped her realize she does have some significant out-of-pocket exposure on this plan. So first of all, if she's hospitalized, she's got a $285 per day copay for the first 5 days of hospitalization. If she has outpatient surgery, she has a $250 copay. ER, $80 copay. Ambulance, $200 copay. And then look at this one, like I was talking about, $175 per day for days 21 through 100 of a skilled nursing confinement. And then if she needs a major diagnostic exam, she has a 20% co-insurance on that. Okay, so you could say, I like to kind of call it the death by 1,000 cuts here. All of these little copays for this and that. Now, when you think about, you know, selling a hospital indemnity plan with an MA, it's much more about just covering that hospitalization. It is about covering all of these little things all with one product. And keep in mind, guys, the average MA out-of-pocket max last year for in-network services was $5,059. And the average for in and out of network services combined was $8,649. So I would ask you guys, if you're selling a lot of Medicare Advantage, how many of your clients have over $5,000 just sitting in the bank waiting for a medical emergency, let alone $8,600? And as a alternative to having that money in the bank, we'll look at the right side of the screen and how we develop HospitalWise to fill in the gaps. Okay, and keep in mind with HospitalWise, this is a cash benefit paid directly to the client, not to the hospital. So as an indemnity plan, this is actually going to pay out based on what you sign up for. So for example, she's got that $285 copay for the first 5 days. Well, we're going to give her the base $300 a day benefit for 6 days. And if she's in the hospital for 6 days, she's going to collect the full $1,800. And she's going to actually have a little bit of overage there that she's going to get to keep and use to do whatever she wishes. Because, you know, again, on hers, she's just got that $285 a day for 5 days she's got to cover. For the outpatient, look, the outpatient surgery, that one synced up perfect. We did a $250 rider for her $250 copay. We did $200 on the ER rider. We did $200 on the ambulance. That one syncs up perfect. And then look at this. I kind of want to keep drawing this out. That skilled nursing rider. So that is a $175 a day copay. Well, we're going to give her $200 per day benefit for those same days, 21 through 100, and it costs $7.41 a month. I mean, that is such a low premium. And then we added on the diagnostic rider for $200. So look at this. We kept that premium just over $50. So now, as opposed to Jane, we really got to make sure, if needed, you've got a way to access $5,000 to pay that max out of pocket on your MA. Well, instead, why don't we just budget for about $50 per month of premium, and now we'll have this HospitalWise in place when the time comes that you're going to need to use your health insurance. So we created something that I'm really, really love in our point of sale tool that makes this strategy easier than ever for you guys really to do, okay? And that's called our HospitalWise Senior Plan Builder. So you guys will see, when you run a quote with us, the very first thing you do is you're going to enter the client's zip code, you're going to enter the client's age. If they're 64 years or above, when you get to the screen where you actually get to build out your proposals, a little box will be in the upper right-hand corner. It says HospitalWise Senior Plan Builder. You click on that box and this screen pops up, and you are actually going to be able to select the MA plan you're enrolling your client in. In this example, we did the Aetna Medicare Choice Plan. And when you hit view, the system is actually going to break this out for you. And on the left-hand side, it looks just like that case study I showed you. Left-hand side, it's going to show you, here's all those copays. And on the right-hand side, here's how we could design the HospitalWise to fill in all those gaps. And I've had a lot of agents that were kind of hesitant to start. And once we built this, they said, Mike, this makes it so easy for me. It really does, because they're actually printing this up sometimes or just showing it to the client on their computer. And they say, now it's really evident to the client what that exposure is. I just show them the left hand of this ledger, and then I show them the right hand, how we're going to have this covered at 100%. And then when they see that premium, it's usually a no-brainer for them to want to sign up. So I highly recommend, if you guys, once you're contracted, if you're not contracted yet, play around in our system and run some quotes and get into the senior plan builder. And I think you're going to find it's a very, very helpful tool when talking to your MA clients. All right, so we're just about to the finish line here. Did want to mention a couple things about getting started with SureBridge, because we do have a couple steps you're going to want to do to make sure you get set up effectively. So first things first, Premier is going to send you out your contracting invite. You're going to fill everything out online. Only going to take about 5 or 10 minutes to get through that. And then once you submit it, you're going to be pending in our system while we run your background check. Once that background comes through, we're going to actually activate your contracts. We're going to send you a couple emails. First email is going to come from us, and it's a welcome email. It's going to contain your agent ID and a temporary password to get in our agent secure site. So you're going to use that email to log in, and the first time you get into our website, instead of going right to the homepage, it's going to instantly launch a very brief agent orientation. Okay, it's basically just like a PowerPoint deck of slides. You're going to read through the content on the slides. You're going to get to the end. There's a very, very simple 10-question quiz at the end. So you're going to knock out that quiz, and once you're through that, then it's going to take you to the home page. Okay, once you're on the home page, one thing you're going to want to do is set up your direct deposit. You're going to see right there up top, there is a direct deposit tab. You click on, go through the steps, get your direct deposit all set up. But then there's still one other thing we need you to do before you're ready to sell. And right after that welcome email, you are going to get an email from DocuSign. You got to watch out for this, because it doesn't have SureBridge in the from or the subject line. It's actually an email comes directly from DocuSign. But we use DocuSign for all of our digital signatures. So you need to create an account before you take your first step. Very easy to do. The email kind of looks like this. You click on that activate button. You're going to set up a password. It's going to get you into the DocuSign homepage, basically. And then from here, on the right-hand side of the screen, you just want to click on that create your signature, and you can adopt a digital one. Once you see a digital signature right there in that part of your profile, you're going to know your DocuSign account is all set up, and you guys will be ready to get selling with us. And at that point, you're going to find we've got training videos, walk you guys through the point of sale tool. We really want to make this easy and turnkey for you. We know you're going above and beyond, bringing us as the second carrier into the mix with your clients. So it's of utmost importance to us that we are easy to do business with and that we are timely. And I think you're going to find that online portal, maybe you've never done any app before, but once you have and you've gotten the hang of it, you're going to love that instant decision. You're going to love clicking on the submit and seeing right there on screen, congratulations, you're approved. And we pay out our commissions twice per week. So, when you kind of look at us compared to the competition, the turnaround time from submitting an application and having that commission in your bank account, I think is really unparalleled. So I went a little bit over, as I'm known to do, but I've got more time. So if anyone has any questions, I'd love to take those. And otherwise, I hope you guys all have a very, very great Thanksgiving.
And Mike, checking the system, you have done a phenomenal job as usual, because there are no questions, and I thank you for that. I'm going to snag back the control of the screen, bear with me a moment, and rectify an error. There we go. So we actually see my screen. Thank you for that presentation, Mike. Very thorough, and I really appreciate the initial part of it that really demonstrates the need for the product, in addition to the benefits that we get as agents by creating an additional revenue stream as well. So thank you very much. I'm going to close very briefly with some additional information, and that is, here's a couple quick tips on how to incorporate the dental into the Medicare sale. I think one of the biggest things that we have as Medicare agents that work in the Medicare Advantage or PDP space is the use of the scope of appointment, and utilizing that as a sales tool is a great way to preface this conversation, because what do we have on a generic scope of appointment? Dental, vision, and hearing products, hospital indemnity programs. So as we go through and do our due diligence in the compliance world, we're also setting up expectations of visiting about additional products, and this is a great way to bring in that conversation. Mike mentioned this as well, where Medicare doesn't cover much beyond anything for the dental programs particularly, and this in the 2020 version of Medicare and You, which many agents use to sell in the Medicare supplement space, on page 49, it demonstrates what's not covered. So you have the gospel according to the Centers for Medicare and Medicaid Services backing up your assertions as well. And it's also important to note that we have the ability to transition regardless of the choice on the base medical coverages. If a person decides to stay with original Medicare and self-insure, this may be a way to address a pending health issue that they know they have and want to help budget for. But also, if they go into the Medicare supplement space, we really need to stress the fact that, hey, Medicare supplements don't cover dental either. And so that's covered also in Medicare and You in the page 69 of the Medicare and You book. And additionally, we talked about the needs of those, even in a Medicare Advantage plan. If they have some dental coverage, in many circumstances, it's not enough. And here's one of my favorite things. It's always important to ask. You never get kissed if you don't ask. So as Pepe Le Pew does with Penelope, we need to ask. And remembering that will make us successful probably half the time. Some things you'll get in addition from us here at Premier, we have a system in place that gives you an opportunity to create an agent profile and store your contracting information. So as you look across the spectrum for other health insurance or other insurance programs, this is a great way to help you electronically contract with those organizations. And as an independent insurance agent, most of the programs you offer require you to have errors and admissions coverage. This program enables you to procure that coverage at a very reasonable price, and it covers you regardless of whom you contract through. As an independent agent, you've got a ton of different options with whom to contract. This will cover you regardless who you contract with. Obviously, we hope it's us, but this will cover you. We also help you keep your license in play with online insurance bundles for continuing education through our association with WebCE. And as an independent agent, you are also responsible for your own personal benefit package. This gives you the opportunity to pick up individual non-cancelable DI coverage at a modified guarantee, on a modified guarantee issue basis, discounted rates where you share in the commission as well. So a way to help beef up your own coverages. Much as where today's program is being recorded and is offered online, our past presentations are also available to you, and they deal not only with individual products and different carriers such as our special guest today with SureBridge, but also different marketing ideas that can help you get in front of the folks that are part of, well, the folks that buy for what you're offering. So you have some different things here that give you an opportunity to do so. And in some of these spaces, a presentation on dental at a faith-based organization is a great topic to put into your rotation. And marketing with providers, well, if you want to network with dentists, that's a great way to help sell dental coverage as well. We do offer electronic support for our contracted agents without cost as well. This quoting tool gives you the opportunity to work much as the plan builder that Mike talked about during his presentation. And in many circumstances in different markets, you may walk into a household where the person is quite happy with their current coverage. And in many circumstances in certain markets, some Medicare Advantage providers dominate that market. This gives you an opportunity to go in, pull up the plan that they have, and fill in the blanks, much as what we discussed on the plan builder as well. We also offer a program that helps you with the Medicare Advantage and PDP programs on remote electronic enrollment programs as well. And both of these systems give you the opportunity to reach out and procure the scope of appointment electronically, filling it out completely to preface the need for additional product, and it also stores it for you for that 10-year period as we are instructed by CMS. We also have a program that helps you put your social media marketing on autopilot as well through our Coverage Made Easy program, and we put all of the incentive programs in a single spot so you can go through and make certain that you are compensated for your marketing activity. The SureBridge sales that we are certain will come to you through today's presentation also helps you qualify for Premier's producer convention as well, which this next year is a cruise from Miami to the Bahamas. You have also an opportunity to pull some different lead programs from our organization, those community-based marketing programs I referred to that are recorded and available on our website and on the YouTube, are part and parcel of that, the different steps on how to make those effective. We also have the ability to pull custom call lists for you as well. There are a number of programs that you can still converse with Ma Bell and cold call for, and we can make those available to you at a low or no cost depending upon your contracting circumstance. Different carriers at this time of the year in the MA world may give you a chance at what I call a Lazarus lead, where you're going to resurrect what someone else may not have sold. This is a relationship type of sale because of your relationship with a carrier, and with our help gets you into that call cycle. We do also have Facebook leads available through the internet's different programs, and we do offer direct mail support based on your production, where it deeply discounts the cost of a mailing based on your production. All said and done, we want your business, and it's important at this particular point in time to realize how valuable these programs can be as part of your personal marketing program and contracting and moving forward with the sale of the plans. You can reach any of us here at Premier through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. We thank you for your time with us here today. We realize it's an investment of your most valuable asset, your time. We appreciate that and the relationship we have with you, or hope to have with you, and look forward to visiting with you in the very near future. So with that said, we wish you a happy Thanksgiving and good selling. Thanks so very much, and we'll talk to you soon.
Thanks, John, and thank you all. I hope you all have a great Thanksgiving.
Thanks, Mike.